Hi, Ellie here, and this is video number 3 in a series of videos about what it's like to go through a lung cancer diagnosis as well as a lobectomy. If you're interested in any of the previous videos, check on my channel, or you can click on the links below. In this video, I'll be talking about the biopsy. Oh, yeah. The lung biopsy, really scary, and I'm doing these videos, I think I've said this before, to try and help give a patient's point of view about what it's like to go through these things. Because you can look things up and they'll give you all the medical and the scientific, but it's very different coming from a patient's point of view. You don't get that. So without further ado, here we go. The biopsy. In my case, they got me up early in the morning. My biopsy was scheduled for 10 o'clock, but I had to have scans beforehand. And that's to determine, to double, triple check where they're going to put the needle. They want to know. So my scans all turned out, and I'm down there and I'm ready for my procedure. The scan started at 8 o'clock. The procedure was at 10 o'clock, so it's about 2 hours beforehand. Before I went in, you know, they fitted me up with an OR fashion must, a little shower cap. They tuck your hair in. You know, you're wearing the hospital gown. You walk into the room, and it looked like an OR. I was really surprised. Wow. And unfortunately, I've seen my share of ORs. Not as many as some people, but I've been through quite a few surgeries. And the main thing was, I walked in, I was like, wow, it's cold. It wasn't just a little cold. It was cold as in I'm in a walk-in refrigerator cold. You know, I'm just there in a hospital gown. Fortunately, they had nice warm blankets. So that was, you know, it's the little things that make a difference. Basically, an OR, you walk in and you've got your big light overhead, like you see in TVs or movie shows. And there was lots of stainless steel. Very cold. Did I mention it's very cold? And actually, interestingly enough, I forgot about the CAT scan machine. It's amazing how the brain processes trauma. But I read up on the procedure to prepare for this video, and I was like, wow, yeah, there was a CAT scan machine because it's a guided procedure. So, yeah, major elephant in the room that I completely forgot about. I do remember, however, getting on a very, very hard, cold table. I remember telling the nurses, wow, this is really hard. So I lay down, and you know, if I was having the biopsy here on my side, not everybody's going to have a biopsy in the same place. If you're a woman and you're having a biopsy on that side, they'll tape the girl up. And so I'm laying there. Things went pretty fast once they got me all ready. And you know, okay, put your arm over your head like this. So I'm laying there with my arm over my head, and it's a very sensitive area in humans, and it's very vulnerable when you're lying there like that. And so, you know, I'm doing a little bit of, you know, I'm really nervous, so I'm doing some OR small talk. And of course they go over the, you know, well, what are you having done today? You know, it's double and triple check, hospital procedure. So after that, and he's like, okay, I'm going to give you a needle to help numb the area. You know, all you'll feel is pressure. And I'm thinking, I don't know about that. And then I asked the doctor, I said, well, when am I going to be knocked out, put under? And he looked at me and said, no, you're not getting any anesthesia like that. You're not going to be being put under. I said, what? What do you mean? I don't want to remember anything. I want to be completely out for this. He said, don't worry, we'll give you something in your IV drip. I go, great. So let me tell you, I was lying there, ow, 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 ow. And yeah, you don't, like, it was not working. And I had had doctors tell me that before. All you'll feel is pressure. But thankfully, he said, okay, we're going to start the drip now. So once they started that drip, I do not remember a thing. I was out cold. Wow. And the medication they used? Fentanyl. When he said fentanyl, I was thinking, oh, wow, that's not going to be strong enough. I'm here to tell you that it is so strong. It is like anesthesia. It is like being knocked out, put under. So incredibly strong. I was so glad that I was in a hospital setting with medical supervision. I can't imagine. Wow, just fentanyl is a very dangerous drug. Don't go there. It should only be used under medical supervision. Full stop. I had monitors and okay. The room wasn't full of monitors, but and I did not have the monitor that went ding. So the next thing I remember was waking up in my room. I don't even remember them taking me up to the room. When I woke up, however, I felt this intense, sharp, burning pain in my left scapular, my shoulder blade. And I told the nurses. That pain actually lasted, not as intensely as directly after the biopsy, but it lasted for a month. It was bad. It was not fun. Let your doctor, or if you're in the hospital, let your nurse know that you are in pain. Don't lie there and suffer. So the one thing that was good was the pain in my chest from the tumor. Maybe it was because there wasn't so much pain in my back, I didn't feel it, but yeah, that was dissipated. And the amazing thing also, I used my hands, I could use my fingers, fine motor skills. It was so bad I could barely type on my phone. Anything, even doing a search on something. I was doing all voice commands. And I couldn't walk, I was stuck in bed. And I couldn't get up without help. All of that was resolved. The physical therapist came by, and I think she was really shocked because I didn't need any help. It was amazing. Amazing. And walking up a lot of steps, it did put me out of breath a lot. But compared to how I was before the biopsy, it was night and day. I was so thankful that I could get that biopsy done. That I was a good surgical candidate. Not everybody is able to get the biopsy done. So the one thing you need to know about the biopsy is it's really good if you can get it done. Well, that's it for this video. Thank you so much for watching. And if you liked this video, please hit the like button below and subscribe to the channel, because I'll be posting more videos in the upcoming weeks and months about my whole cancer journey, as well as updates as to how I'm doing. and what you might expect, and what you might expect after your lobectomy a year out, more than a year out, or 6 months out, etc., etc. So, as always, take care and stay strong. Hi, Ellie here, and this is video number 3 in my series of what it's like to go through a lung cancer. And it may be a little tough to go through, but hopefully I've alleviated. And I did not have the monitor that went